Hi, I'm going to be doing the intradermal insulin injection for this video. So the first thing I would do is I would um, get the supplies that I need, and I would head over to the um, medication dispensing area, and I would pull up the provider orders, and I would verify the provider orders, and I would verify the orders to the MAR, and then I would pull out the medications, and I would verify the regular insulin against the provider order and the MAR, and I would verify the NPH insulin against the provider order and the MAR, and I would have a second nurse check me on that to make sure that I have the right ones, and we would both be verifying our correct medication, correct patient, correct dose, correct route, correct time, and correct documentation. And so if all of that matched, I would gather my supplies and I would head over to the patient's room. Hi, my name is Tiffany. I'm going to be your nurse today. Can I please verify your first and last name and date of birth? And as they told me, I would go ahead and perform hand hygiene, close the curtain. I would check their wristband to verify. And then I would head over to the computer and pull up the MAR, where I would do my third verification check of the medications. And I would also have my calculations ready, knowing that I'm going to give 4 units of regular insulin, 8 units of NPH insulin, and 12 units combined, and I would have the second nurse verify that as well. And then I would ask the patient if they had any allergies to medications, and that includes drug, seasonal, and food allergies. And if they did not, I would go ahead and let them know that I'm here to give them their morning dose of insulin, which includes the R fast-acting insulin and the NPH intermediate-acting insulin. I would let them know that the fast-acting insulin is basically a replica of what the pancreas would produce in a non-diabetic person. And so we're giving it to them because their pancreas isn't producing the insulin. And then I would also let them know that the NPH insulin is an intermediate acting insulin, which is a combination of regular insulin and protamine. It lasts up to 16 hours. And it's basically used between meals and overnight to control blood sugar. And I would let them know that when I do inject, there might be a little bit of burning or stinging, but that's normal. A couple other normal side effects would be low blood sugar, nausea, a little bit of weakness. But if they experienced any adverse side effects like a fast heartbeat, seizures, or if their vision starts to blur, we want to notify the doctor right away. And so if they didn't have any questions, then I would go ahead and perform hand hygiene. I would take their blood glucose, making sure it's the correct time for their lunch to be here within 30 minutes. And then I would go ahead and I would notate their glucose level in the health record. And I would go ahead and perform hand hygiene. And I would put on my gloves. I would lift the patient's gown, and I would inspect the area that I wanted to give the injection, making sure that there's no bruising or any discomfort when I palpate. There's no masses in that area. If there was, I would try to choose. You really want to give insulin in the stomach area because that's where there's a nice amount of subcutaneous tissue. And so I would just try to find the best spot there, make sure that, they don't have any discomfort there. And so I would go ahead and get an alcohol swab and I would circle in an outward motion 2 inches. And I would ask the patient just to let it air dry, not touch it, don't put the gown back down while we prepare the insulin. And then I would go ahead and check, okay, so this is my regular. I would roll it between my hands, kind of warm it up a little. You don't want to shake it. And I would do the same with the NPH. The NPH, it's really important that we do this so it mixes the suspension of the combined type insulin. Okay, and I would make sure that I have my insulin safety syringe. This syringe measures in units, and so I would know I would want 4 units of regular, 8 units of NPH with a combined of 12. And so the first thing that I want to do is get my alcohol swab again. And go ahead and just clean the tops of these vials here. And then I would want to get 8 units of air to inject into, let's see, 5. Okay. To inject into the NPH, making sure that when I do it, it does not touch the actual insulin itself. I just want to inject that air in there so there's not a buildup of negative pressure. Okay. And then I would want to pull it down to 4 units. And I would inject that in the regular insulin. And then I would, after injecting that into the regular insulin, also it's just good practice to make sure that it doesn't touch the solution. So then you go ahead and then you pull down 4 units. Okay. And you want to go ahead and verify that against the MAR again, and have your second nurse also verify that it is the correct amount, the 4 units. Okay. 4 units. It's really hard to see, but there's 4 units there. And so then I would want to make sure there's no air bubbles, which I don't see any, but if there were, I would want to very gently just kind of push those out. And so then the next thing I would want to do is I would want to inject into the NPH, making sure that I do not push down on the plunger, because I don't want to mix the insulins in the vial. So then I would go ahead and pull down 8 more units to have a combined number of 12. 10, 11, and 12. Okay, and then I would also have my second nurse verify this again, and I will make sure that there are no air bubbles in here. Okay, and we're good. There are no air bubbles. Okay, so then I'll go ahead and show you that we are at 12 units. Okay. And then, okay, so I verified that against the MAR. The second nurse verified it against the MAR. If I had made this while I was away from the patient, I would have labeled it with both of the types of medication and the dose. And I would also, on the insulin, write my initials and the date that I opened and uncapped them. So now what I want to do is hold this like a dart between my thumb and my forefinger. And on that area, I would pinch up on the patient's skin, and because I can only get about an inch, um, with I want to go ahead and inject it at a 45-degree angle with my 1 mil 29 gauge half an inch insulin syringe. And I would go ahead, and you want to just go in at 45, and you want to do it quick so it prevents, unnecessary pain. And then you want to go ahead and hold it, the bevel part, and then you want to slowly inject the medication, letting the patient know, again, that if there's a little stinging or burning, that's normal. I would get my gauze and hold it between my fingers, and then go ahead and pull this out and cover that. I would push up my safety, and I would discard of this in my sharps container. And there's no blood or anything, so I wouldn't put a band-aid on it. I would remove my gloves. I would perform hand hygiene, and I would document that I would document.